Have you noticed subtle yet concerning changes in a loved one over the past year? Many people believe that old age ends suddenly, but in reality, the body often begins signaling its decline months, sometimes even a year, before reaching its final stage. The challenge is that these warning signs are easy to overlook. They start small, barely noticeable at first, and only become clear in hindsight. Unfortunately, by the time families recognize them, the opportunity to prepare and make the most of their remaining time has often passed. In this video, we'll discuss 5 key indicators that may appear up to a year before an elderly person passes away. Some of these signs might seem like natural parts of aging, while others, though subtle, reveal deeper changes within the body. By recognizing these signs early, you can offer better care, create meaningful memories, and, most importantly, ensure your loved one's final stage of life is as peaceful and dignified as possible. Stay with us until the end, because understanding these 5 signs can help you navigate this journey with greater awareness and emotional preparedness. When you know what to expect, you won't be caught off guard. Instead, you'll be able to make the most of the time you have left with the people you love. Now, let's begin. 1. Unexplained weight loss. One of the first and most telling signs that someone may be in their final year of life is noticeable weight loss that occurs without any effort to diet or exercise. At first, it may seem insignificant, a belt that needs adjusting, looser clothing, or a loss of interest in favorite meals. Many families assume it's just part of aging, but unintentional weight loss often signals that the body is no longer absorbing nutrients properly, muscle mass is deteriorating, and essential systems are slowing down. While some muscle loss is expected with age, rapid weight decline suggests something more significant is happening. The body may be struggling to process food, absorb protein, or maintain energy levels, leading to increasing weakness. This doesn't just make movement more difficult, it also raises the risk of falls, weakens the immune system, and makes the person more vulnerable to infections. A reduced appetite is another major contributor. Many elderly individuals simply stop feeling hungry as they once did. Their sense of taste diminishes, food no longer seems appealing, and they may begin skipping meals or eating much smaller portions. This isn't just a preference change. It's a sign of the body slowing down. As it prepares for its final stage, it sends fewer signals to the brain to seek food, resulting in lower energy, declining strength, and overall health deterioration. In some cases, weight loss is linked to underlying medical conditions. Chronic illnesses like cancer, heart failure, or kidney disease can quietly progress long before other symptoms become obvious. Even conditions like depression or cognitive decline can lead to reduced eating, creating a cycle where the body lacks the fuel it needs to sustain itself. Families often try to counteract this by encouraging their loved one to eat more, offering favorite foods, or introducing high-calorie supplements. While these efforts may provide temporary relief, ongoing weight loss despite increased food intake suggests a deeper change is underway. At this stage, forcing large meals may not be beneficial. Instead, focusing on comfort, easy-to-eat foods, and proper hydration can have a greater impact on maintaining quality of life. If you notice significant weight loss in a loved one, especially if they are eating less, feeling weaker, or becoming less active, it's time to pay attention. This isn't just about physical appearance. It's the body communicating an important message. Understanding that message now allows you to approach the journey ahead with clarity, compassion, and the ability to make every remaining moment truly meaningful. Number 2. Extreme fatigue and weakness. One of the most noticeable changes in the year leading up to the end of life is a deep, persistent fatigue that doesn't go away with rest. It's not just feeling a little tired after a long day, it's a profound exhaustion that makes even simple tasks feel overwhelming. Getting out of bed becomes a challenge. Walking across the room requires effort, and activities that once felt routine, like cooking, dressing, or even holding a conversation start to feel too draining. This isn't just a result of aging, it's a sign that the body is conserving its remaining energy. As organ function begins to slow, the body starts prioritizing what's most essential. The heart doesn't pump as efficiently, circulation weakens, and muscles don't get the same level of oxygen they once did. This is why many elderly individuals in their final months feel weak, unsteady, and unable to sustain the same level of activity they once enjoyed. Another key factor is metabolic slowdown. The body is designed to produce and use energy, but as it prepares for its final phase, that energy is redirected. Instead of fueling movement, the body shifts toward preservation. This is why someone in decline may start sleeping more, needing longer naps during the day, and finding it harder to stay awake for long periods. Some may even experience sudden drops in energy, where they seem fine one moment, but completely drained the next. But perhaps the most heartbreaking part of this process is the emotional impact of fatigue. Many seniors who once took pride in their independence begin feeling frustrated or even embarrassed that they can't do what they used to. They may withdraw from conversations, avoid social interactions, or stop engaging in hobbies, not because they don't care, but because they simply don't have the energy. This can lead to a cycle of isolation, where they stop trying altogether, which only accelerates the decline. For families, watching a loved one go from active and engaged to exhausted and withdrawn can be painful. It's easy to assume they're just being lazy or that they need to push through it, but the reality is that forcing activity won't help. What matters most is understanding their limits, allowing them to rest when needed, and making their remaining days as comfortable as possible. If you notice a loved one experiencing deep, ongoing fatigue that isn't relieved by rest, take it as a sign that their body is going through a major transition. This is the time to cherish conversations, create moments of peace, and support them without expectations. Because in the end, what matters most isn't how much they can do. It's that they feel loved, understood, and at ease. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 3. Increased cognitive confusion or withdrawal. As a person approaches the final stage of life, one of the most striking changes can be seen in how they think, communicate, and interact with others. You may notice that someone who was once sharp and engaged starts to forget things more often, struggles to follow conversations, or seems disoriented in familiar places. They may repeat themselves, forget names, or lose track of time, even when they never had memory issues before. These subtle cognitive changes can happen months or even a full year before death. This isn't just everyday forgetfulness. The brain, like any other organ, requires a steady flow of oxygen and nutrients to function properly. But as circulation weakens and oxygen supply to the brain decreases, cognitive function starts to decline. The person may become easily confused, have difficulty making decisions, or struggle to recognize people and places they've known for years. In some cases, they may even have brief moments of lucidity followed by sudden episodes of confusion, almost as if their mind is fading in and out. Another common sign is emotional withdrawal. Someone nearing the end of life often loses interest in social interactions. You might notice them speaking less, engaging less, or spending long periods simply sitting in silence. It's not that they don't care about their loved ones. It's that their brain no longer processes emotions and engagement the same way. Conversations become tiring. Loud environments feel overwhelming. And eventually, many seniors retreat into their own world. You may also notice changes in mood and behavior. Some individuals become more irritable, anxious, or easily frustrated, while others seem unusually calm, detached, or indifferent to things that once mattered to them. This isn't just a personality shift. It's often a result of the brain adjusting to the body's decline. As cognitive function slows, emotions become harder to express, and the person may stop reacting to situations in the way they used to. For family members, this stage can be especially difficult. Watching a loved one lose touch with reality or pull away emotionally can feel like losing them before they're actually gone. But it's important to remember that this isn't something they can control. Instead of trying to bring them back into conversations, the best thing you can do is meet them where they are, speak gently, offer reassurance, and understand that even if they don't always respond, they can still feel your presence. If a loved one is becoming more forgetful, more confused, or less engaged, don't ignore it. These are often early signs that the body and mind are preparing for the final transition. This is a time to be patient, cherish quiet moments, and focus on creating an environment that feels safe, familiar, and peaceful. Because even when words fade, love and comfort can still be felt. Let's move on. Number 4. Frequent infections and slower healing. As the body enters its final stage, one of the most noticeable physical changes is a weakened immune system. A once resilient person may now seem to catch every cold, flu, or minor infection that comes their way. What used to be brief illnesses now linger, and even small wounds, like cuts or bruises, take much longer to heal. These changes are not random. They are clear signs that the body is losing its ability to defend and repair itself. One of the biggest concerns is recurring infections. Conditions such as pneumonia, urinary tract infections, UTIs, skin infections, and even gum infections become more frequent as the immune system weakens. Families often assume these are just isolated incidents, but when infections start occurring repeatedly or take unusually long to resolve, it often signals that the body is struggling to fight back. Even antibiotics, which may have worked well in the past, become less effective, requiring stronger medications, longer recovery periods, or multiple rounds of treatment for what once were minor ailments. This decline occurs because as circulation slows and organ function weakens, the body becomes less responsive to treatments. Another overlooked issue is chronic wounds. If small cuts, sores, or bruises are healing poorly or reopening frequently, it may indicate poor circulation. Reduced blood flow prevents oxygen and nutrients from reaching the skin and tissues efficiently, significantly slowing the healing process. For those who are less mobile, pressure sores become a serious risk, potentially leading to severe infections if not carefully managed. What's especially concerning is that infections in the final year of life don't always present in the usual way. Instead of a high fever or obvious symptoms, an elderly person might simply appear more fatigued, confused, or disinterested in eating. In fact, for many seniors, a sudden decline in mental alertness is often the first sign of an infection, sometimes appearing before any physical symptoms. Recognizing these early changes can help ensure they receive the right care and comfort during this stage. For families, watching a loved one endure repeated infections can be both frustrating and heartbreaking. It's natural to want to push for aggressive treatments, believing that one more round of antibiotics or another hospital stay will turn things around. But there comes a point where the focus shifts from curing to providing comfort, ensuring they stay hydrated, keeping their skin clean and moisturized, and reducing physical stress can often do more for their well-being than additional medical interventions that may only prolong discomfort. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I encourage you to do so and turn on notifications so you never miss a video. Your support allows us to continue creating meaningful content to inform and inspire you. Now, let's continue. Number 5. Major changes in breathing or circulation. One of the most telling signs that the body is preparing for its final stage is a noticeable change in breathing patterns and circulation. You may notice that your loved one breathes more slowly or shallowly than before. At times, they might pause between breaths, or their breathing might become irregular, speeding up and then slowing down unexpectedly. Some people experience a gentle, rhythmic breathing pattern called Cheney-Stokes respiration, where breathing alternates between deep, rapid breaths and long pauses. These changes can start subtly, but over time they become more pronounced and more frequent. Another common sign is weakened circulation. You may notice that their hands, feet, or even their nose and ears start feeling cold to the touch. The skin may appear pale, bluish, or mottled, especially around the fingers and toes. This happens because the body is prioritizing blood flow to vital organs, reducing circulation to the extremities. It's a clear indication that the heart is not pumping as strongly as before this stage. Some people also experience more shortness of breath, even with minimal movement. Simply sitting up, speaking, or shifting positions might cause them to feel winded or out of breath. You may notice them breathing through their mouth more often, or they may suddenly need to stop and catch their breath while talking. If they were once able to walk across the room easily but now struggle to do so, their lung function may be declining. In some cases, fluid buildup in the lungs can make breathing more difficult. This can cause a persistent cough, gurgling sounds, or even a feeling of tightness in the chest. Many people assume it's just congestion from a cold, but in elderly individuals nearing the end of life, it's often a sign that the lungs are weakening. This can make lying flat uncomfortable, and they may prefer to sleep propped up on pillows or in a recliner to ease their breathing. For family members, seeing these changes can be frightening. It's natural to want to help, to encourage them to take deeper breaths or to worry that something urgent is happening. But in many cases, this is simply the body's natural way of slowing down. There may not always be a way to reverse these changes, but there are ways to make them more comfortable. Keeping the room cool, using a humidifier, or offering small sips of water can help ease discomfort. In some cases, medications or oxygen therapy can provide relief, but the focus shifts toward comfort rather than trying to fix the issue. If you notice these signs, changes in breathing, cold hands and feet, or a bluish tint to the skin, pay attention. These are often indicators that the body is conserving energy and that circulation is slowing down. It's a time to be present, offer reassurance, and create a peaceful environment where they feel safe and at ease. Months or weeks before the end, the most important thing you can give your loved one isn't medical intervention. It's comfort, dignity, and the knowledge that they are not alone. Final thoughts. As we come to the end of this video, take a moment to reflect on what we have discussed. Significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation. These 5 signs often appear in the year leading up to an elderly person's passing. They may not all happen at once, and they may not always be obvious at first, but when you start noticing them, it is a sign that the body is preparing for its final transition. For many families, these changes can be difficult to accept. It is natural to want to fight against them, to encourage a loved one to eat more, move more, or push through exhaustion. But sometimes, the best thing we can do is listen to what their body is telling us. Instead of focusing on trying to reverse the inevitable, we can shift our focus to making their remaining time as peaceful, comfortable, and meaningful as possible. This might mean prioritizing rest over activity, comfort over medical interventions, and presence over expectation. It is about creating an environment where they feel safe, understood, and surrounded by love in their final chapter of life. Understanding these signs is not about fearing death, it is about being prepared for it. When you recognize these changes early, you can offer better care, make important decisions ahead of time, and ensure that your loved one's final months are filled with dignity, warmth, and connection. Instead of being caught off guard by sudden changes, you will have the awareness to adapt, the time to make necessary arrangements, and the ability to focus on what truly matters: spending quality moments together. This is a time for cherishing conversations, sharing memories, and reminding them that they are valued and never alone. It is also a time for personal reflection, allowing you to find peace in knowing that you are doing your best to support them with love and understanding. If you are noticing these signs in someone close to you, take a deep breath and remember, you are not alone in this journey. Many families have walked this path before, and while it is never easy, knowing what to expect can help you navigate it with strength, patience, and compassion. This process is not just about preparing for loss. It is about making the most of the time that remains, ensuring that every moment is meaningful and filled with care. Thank you for joining us today. We would love to hear from you. Leave a comment below and share one thing you learned from this video and how you plan to use this knowledge in your life. Your thoughts matter to us, and your comments provide encouragement, not just for us but for others who may be going through similar experiences. If you found this video helpful, please like, subscribe, and share. Your support allows us to continue creating content that informs, inspires, and helps people navigate life's most challenging moments with clarity and compassion. Thank you for watching, and we look forward to seeing you in the next video.